Looks like everybody has filed in from the waiting room. So once again, hello, good afternoon, everyone, and thank you for joining today's HI Office Hours session. My name is Sydney Reichert Jensen, and I am my Health's Marketing and Communications Manager. All right. I'll be your host for today. We're really glad you're joining us and are able to tune into today's educational session on cybersecurity in healthcare, staying informed and protected. So as we kick off today's presentation, I have a few reminders for everyone. Joe, if you would be so kind as to go to the HI Office Hours Decorum slide. Thank you. So first, panelists, please mute yourself when you are not actively speaking. Secondly, attendees are automatically muted in the webinar. So to ask a question, please use the Q&A or the chat function, and I'll be monitoring that throughout the session. And we will have an open Q&A at the end of the session as well for additional questions. Today's presentation will be sent out to all attendees following the session in a PDF format via email, so look out for that. Share it with your colleagues, keep it for your records, and we will also have a video recording of today's session as well. Now with all that out of the way, next slide, Joe. We'll dive into today's topic, cybersecurity and healthcare, staying informed and protected. And I would like to introduce our speaker for today. Go ahead and do the next slide, Joe. Thank you. So today's session is led by Joe Walker, a co-founder of MyHealth and Senior VP of Technology Services and Compliance. Joe also serves as MyHealth's HIPAA Security and Privacy Officer, and he plays a national role as the Central Regional Coordinator for the Patient-Centered Data Home Initiative. He has more than 15 years of experience in health IT and compliance, helping to shape governance, policy, and secure data sharing both here in Oklahoma and across the country. So we're excited to have him here today to share practical insights on cybersecurity and healthcare. With that, Joe, I'll hand it over to you.
All right, thank you. My intention today is to make sure that you don't just have another standard HIPAA training session, but that there's an opportunity for us to just have just straightforward conversation about what's happening today. And of course, I'm going to give my perspective on it, but I look forward to the opportunity at the end for you all to ask questions and for us to have conversations about what this means for us in this arena, both for my health and for the providers that are part of exchanging health information. In the healthcare sector, the information we control is sensitive, and that means it's also something that, since we consider it valuable, others perceive that it has value, and it is a target. It's an obvious jewel to be stolen, if you will, because at least the majority of cyber criminals that are operating today, from the perspectives that we see from existing events that become publicized, it is almost always being driven by a goal for financial gain. And so anytime somebody sees an opportunity, or anytime an attacker sees that there may be some opportunity to capture something valuable that somebody might be willing to pay to prevent disclosure of, or to pay to regain access to, that thing becomes valuable and that thing becomes a target. And healthcare data has always been that way. One of the things when MyHealth was getting started, we discussed was just practically what is the value of health information. Every single person values their own privacy immensely, but when we take a step back and look at it, like if I have allergies or I have a cold, what is the value to somebody on the other side of the world, or somebody even down the street from me, in knowing those things? Usually it's only valuable if somebody has an intent of doing harm, or someone has a goal of extorting me or something like that. But there is real value on the black market for that kind of information, because there are plenty of people that are willing to buy that information and then to find ways to use it for whatever things they can dream up, often used for initiating attacks against people based on their private information, or for impersonating those people and filing false claims and attempting to collect payment. So there can be many motivations for cybercrime. The bottom line for us, though, as stewards of health information and for providers who are protecting the health information of their patients, is to keep the information away from those who may want it. So when we're exchanging health information, it is our business every day to ensure that we can safely and securely exchange health information to the parties it's intended to reach, make sure it gets there safely, and make sure that we prevent unauthorized access to it in the process. There are regulatory costs associated with any breaches beyond whatever a cyber criminal might try to extort from us. So it's critical to make sure we are also watching it from that standpoint. There's legal risk associated with any lacks in security and the potential for us to be in legal trouble if we're not taking appropriate precautions, given the threat landscape that we live in. It is a legal requirement under HIPAA for organizations to assess their risks and to put into place appropriate mitigations against those risks. So it's not the kind of thing that you can just point a finger if somebody exploits your system and gets access to your data. The investigation that follows is in part a determination on whether you are actually acting in a responsible way in compliance with the law and whether your system was actually protected the way it should have been in the first place. And so there are real liabilities, fees, and fines that often get assessed against victims of cyber crime if an investigation after the fact shows that the reason they were compromised was a result of them not actually having an appropriate level of mitigation in place to prevent that from occurring. So protecting patient health information, it's not only about protecting our bottom line, and it's not only about protecting ourselves against legal problems. It's also critically about protecting the individuals, those who are the subject of the information, because when someone's health information, I mean, it goes for any identifying information, but even especially health information is compromised, those individuals are victims of that, and they are directly at risk of being targeted or at risk for having their confidential information exposed. And there are a myriad of reasons why individuals may have severe concerns, sorry, strong concerns about their own information being disclosed. So it's imperative that we take our responsibility seriously, that all providers and that all those that are involved in the secure exchange of health information not take it for granted, the trust that our patients and your patients have throughout this process, that all of us are taking the necessary steps to keep this data safe and to protect their privacy. In today's world, there are so many threats that are coming every day. It's impossible to summarize in a brief presentation all of the threats that there are out there, but we can certainly hit some of the major highlights. By far, the most prevalent way that we have seen organizations be compromised in their cybersecurity, where the confidentiality of their systems or information is breached, is through phishing and social engineering. So those are attacks where someone in your organization clicks a link or someone clicks something on a website that enables some interaction with their machine that allows something that wasn't intended to happen. And it can be as simple, even as much as we build in safeguards, the systems that we use every day are constantly being found to have vulnerabilities and issues that bad guys can figure out how to exploit with simple links or even with images that are displayed inappropriately or may seem to be displayed appropriately, but they cause the opportunity for the bad guys to be able to get a foothold that they otherwise wouldn't be able to get. So a link in an email that someone clicks thinking it's an appropriate thing, thinking it's part of their standard business, they click to open the file and it opens a door basically for somebody to be able to access their machine, to be able to issue commands to their machine, to be able to explore what's on their computer and then be able to insert things into their computer to be able to take control and gain access to things that they have access to. And there are many professionals who make a living out of doing this, out of exploiting people's computers. So the expertise that they have should not be underestimated to be able to compromise even a current up-to-date machine with all of the safeguards in place. And those that work in cybersecurity are aware that these attackers have a very rich toolbox available to them. So the most effective initial safeguard that all of us can have in place is just awareness of the fact that this exists, that these threats are continuous, that even with all of the efforts that we continuously take to protect ourselves, to make sure that if someone clicks that kind of a link, it can't actually do anything in our systems. The fact that every new release of every new software platform is a potential new zone where security vulnerabilities can exist. And if bad guys discover those before the good guys can fix them, it creates new vulnerabilities that can be exploited. So it's a cat and mouse game, and we can't assume that our machines are always safe. So the most critical thing for us and for those that we communicate with is awareness that these attacks are constant, that we are targets, and we should be suspicious. We want to promote a culture of caution so that we're not clicking links, not opening things that can compromise us. And social engineering, of course, goes right alongside that. Social engineering is where maybe there isn't something presented that can take over your computer directly, but there's an attempt to acquire sensitive information from you, someone posing as somebody who should be allowed to have sensitive information, and they come seeking passwords, they come seeking personal details that enable them to be able to conduct identity theft or to be able to impersonate you to someone else. And those are the kind of things that really go beyond the technical safeguards because anyone who can contact anyone else can ask questions and pose as someone else. So those are common vectors that we see attacks come through that often are the primary sources of compromise. The other things that you see on the slide here are additional things that we have to watch out for, obviously. Often they're things that come as a second or third step in the process when someone gets a foot in the door through somebody giving them sensitive credentials or gives them an opportunity to take control of their machine by clicking a link. They often will move to establishing a foothold that enables them to do other things, such as putting ransomware into the environment or to start impersonating that person to others internally and doing additional social engineering to be able to gain additional access within the environment they've gained access to. And we also have to be mindful that cyber attackers from outside the organization are not the only risk we face. The fact that people inside our own organizations may intentionally or unintentionally make mistakes that open up security vulnerabilities or that compromise our systems, something we have to be mindful of and watch out for. So we have to control for that. All of the systems we use are potentially vulnerable. We have a lot of devices in our environments as well, and every device, especially devices that are connected to networks, can be points of attack or points of vulnerability. And maintaining the security of those devices is essential. It's actually a common challenge for security personnel when they come into an environment that they're trying to secure to identify all the things, every copy machine that's network connected, every camera that's connected to the network, every mobile medical device that uses a wireless connection to upload its data are potential places where an attacker could find a way to compromise that device. And essentially, all of these devices that we use today have some form of processor on them. The majority of them actually have the equivalent of a computer operating system so that if somebody were to be able to start issuing commands to that device, just like every loyal computer out there, those devices will execute the commands that are given to them by what their system suggests to them is a valid input. So they can be commandeered and used as an entry point for someone to gain a foothold into the network. So we can't overlook those. Having outdated software and old systems is one of our biggest struggles as well, because especially where medical devices are concerned, because a lot of the equipment that is used to take care of patients is a major capital investment. And when you have an imaging machine or a lab processing machine, those types of equipment that have specialized functions, those are very expensive items. And once we invest in them, we expect to be able to use them for a long period of time. But if the software that runs on them is not being updated and vulnerabilities are discovered, and especially if they're made public so that anyone that's out in the public sphere can actually learn how to compromise those pieces of equipment, those become liabilities to our networks because someone can find a way to get into those and create a foothold based on publicly available information. So it's really critical that we don't overlook those kind of devices and that we are including those in our considerations of maintaining the most up-to-date, most bulletproof network possible. And the last item on this list is really calling out what's different in 2025 versus 2024. What we've seen over the past year in the as the emergence of large language models and the AI tool set has come into common use in the world has been an exponential increase in the effectiveness of attacks. We've also had a corresponding increase in the defenses, but we have to make sure those defenses are deployed and in place because the attacks are getting immensely better. That goes for phishing and social engineering. Impersonation of people is much more effective now than it used to be, but it also goes for just the sheer raw coding elements. Like we have a reality now where as soon as software patches are released and go into the public domain, or even before then, as soon as there's any opportunity for attackers to learn about changes that are being made to a software platform, AI tools can be used to analyze the changes that are being made and to quickly reverse engineer what is being fixed and what is being patched. So that, and then the AI tools are also able to quickly create programs and code. They can literally code in seconds programs that can exploit the vulnerabilities that are being patched. And as soon as they have those packages, those can be quickly put into attack vehicles that can then be sent out looking for those devices. So the vulnerability window that exists from the time a security patch is released to the time that we get it updated in our own environments is a critical time window. And the AI tools that cyber attackers are using has given them a leg up to where they can attack much more efficiently now than they used to be able to. They can get attacks launched within minutes of gaining access to information, and our systems may not have even had an opportunity to be alerted that updates are available. So being on top of those updates is an increasingly critical thing. In addition, having layers of security so that your security shield is not completely dependent on a single device or a single protective unit is also critical so that we have those layers between us and the outside world so that if one of our machines needs an update and it hasn't been updated for a while, anyone who might want to attack it has several layers that they would have to be able to break through before they could ever reach that device. So those are the kind of defensive measures that we need to continuously be thinking about in order to function in today's world. So among other things, and I've been talking about this as I've been showing the previous slides, but I'll just emphasize some of these things. The awareness that our staff have is critical. The culture that we maintain is one of the most essential safeguards that we have because ultimately, at the end of the day, it's the people in our organizations who need access to our systems that are also the primary vehicles for attackers to be able to get through. The easiest way for an attacker to get through is through an open door. And those doors have to be open in order for our staff to do what they need to do. But if our staff are aware, and I'm of course speaking about virtual doors here because we're talking about cyber stuff, but there may also be physical doors. Having physical access to machines can also be a pathway for people to do things, but that's less common in today's cybersecurity landscape. And the main topic of our focus today is on the cybersecurity front. So the attacks coming over our networks and over the internet are typically the most prevalent threats to us. So having awareness training is critical up front. And secondarily, we have to make sure that we're ready to respond. So once our staff are aware, that increases significantly the likelihood that they're going to report something. Do we have the processes in place to respond? That's, I saw a story recently about a security researcher in an airport who saw a bag that had been left abandoned that had sat there with no one around it on a chair for 5, 10 minutes. So following airport security, he called in the issue and then continued to sit there and watch, and nothing happened. And so he went and talked to the gate attendants and pointed it out, and they called it in, and nothing happened. And he went and reported it to a pilot that was standing nearby. And this is like every 5, 10 minutes, he reported to someone else saying, nobody is taking care of this, and yet your signs all tell us to report it. And it took 2 hours before somebody actually responded to the fact that there was this abandoned bag there. And he reported that out just to make the point that awareness only goes so far. We have to be prepared to actually act in response when something is brought to our attention, or all of that awareness adds little value in the end. So having incident response plans ready, having people ready to jump on and investigate or handle what comes, something that has to be a part of our planning process. Going along with that thread, our vendors that we rely on, they're all required under the law to conduct their own security assessments and to protect their own resources so that those can stay safe. But as customers of those tools, we have responsibility as well to verify that the vendors are doing what they can do. So it's important to be checking on that. And often that can be done efficiently by having a third party assess the vendors and looking for the verification by that third party. So SOC 2 audits, or My Health uses High Trust as our third party auditor. And being able to share those audits can create a level of confidence for the customers that not only is this organization taking security seriously, but that it's being validated by an independent third party. And we don't have to do like the in-depth colonoscopy on, like, every doctor's office doesn't necessarily have to be the cybersecurity expert. We can rely on other cybersecurity experts to verify that our vendors are doing what they need to do. But that comes through good contracting to ensure that the obligations that vendors have to us include that they're having these kind of assessments and that they're obligated to implement the right kind of controls to protect us. Um, Critically, the logs that are being kept by our systems about the access that's made have to undergo review as well. This is another area where It's like if you have security cameras monitoring a physical environment so that everything that happens in that environment can be observed, but there's nobody actually watching or responding to anything that happens. It ultimately doesn't serve as a deterrent or an effective detection device. It's essentially just recording a log so that later somebody can come back and actually get some idea of what might have happened. But that isn't an effective tool in helping us stop things before they get out of hand if they're not being monitored. So auditing logs, establishing what is standard expected behavior, and investing some effort in being able to flag anomalies and investigate those are the kind of things that are critical to do in order to stay ahead of the game in cybersecurity. Minimum necessary access is also critical. That's, as I was saying earlier, staff are often the ones that have the access to things the bad guys are trying to get access to. And to the degree that a bad guy tries to get to something, or even an internal actor tries to make inappropriate use of something they have access to, one way of mitigating the effects of an attack are to ensure that the amount of access that's available is limited, and that ensures that we have the maximum degree of control so that we can minimize the effects if something does get through our defenses. So keeping staff trained, keeping staff up to date on the latest technologies when it comes to authentication is also a really helpful way to go. One of the ways bad guys try to compromise user accounts is by authenticating as those individuals. Usernames and passwords have historically been the primary way we've secured systems, but in today's day and age, multi-factor authentication is becoming critical. And in fact, that's something that my health, because our primary customers have always been providers that are working in secure medical environments, we have tried to accommodate the efficient workflows of those providers and allowed providers to authenticate to the MyHealth system just using a single factor of authentication, but that is going away. We're getting rid of that and getting the two-factor authentication. So providers are going to have to use that model soon when they're connecting to the MyHealth portal. That's going to be coming within the next couple of months. So you'll be seeing that. In tandem with that, MyHealth is also working with EMR providers to create the opportunity for single sign-on integrations. So on one hand, the multi-factor authentication is going to slow down the authentication process for providers that are dependent on that method of access, but it will dramatically increase the confidence and reduce the risk of someone inappropriately accessing the environment. The flip side of that is we're also bringing in additional technologies that allow us to make use of the authentication that's already occurring so that where our customer organizations are already authenticating their users, that authentication can carry over to the MyHealth system, and providers can seamlessly move between their system and the MyHealth system to be able to access patient records with a high level of confidence in their authentication process. So embracing those technologies, understanding them, implementing them well is critical in order to protect access. So as long as those credentials are protected, that is a critical function for the staff to be on top of. Keeping things updated and, of course, teaching staff to be suspicious are all components of what it takes to maintain a culture that is resistant to attack. So at MyHealth, we have several key functions. As I mentioned earlier, we do embrace the high trust standard at MyHealth. High trust is a security framework model that incorporates best practices from multiple types of security frameworks. So the ISO standards, the NIST standards, the requirements that are embedded within HIPAA, and several other security standards are all considered by high trust. They put them into a framework and define kind of their own standardized statement for different topics of what needs to be implemented. Their framework also scales the type of controls that you need to have in place based on the kind of data you're protecting, the volume of data you're protecting, and the profile in which you operate. Like my health is connected to the internet directly, and because of that, we have a risk profile that is pretty high. So our security controls have to be set at a high threshold. And we get assessed by a high trust assessor who evaluates us on all of the things that are currently considered best practices in the industry. And as they go through that assessment process, that evidence is collected. It is then presented to yet another third party who evaluates the evidence collected by the primary third party who's doing the assessment. They validate that, and it all goes into the report that we then are able to share with our participants. So if anyone is interested in seeing that, needs to see that in order to meet their security oversight obligations with respect to your relationship with us, that's absolutely something we support. You can just contact your client services rep, and they can get that request put into us, and we can get that paperwork to you. But at My Health, we also, as I was mentioning earlier, we've got controls that govern the authentication of getting into records. We have continuous auditing of all of the data that comes through our environment. We retain original copies of everything we receive. So if there's ever a need to be able to rewind the clock and replay the information, we have the ability to do that. We maintain all of the data in encrypted vaults and encrypted at storage, encrypted in motion, sorry, encrypted at rest, encrypted in motion, so that only the authorized processes and authorized individuals ever have the opportunity to actually see unencrypted forms of the data. Those are all safeguards we have implemented throughout our infrastructure. We have a number of vendors that help us with this, and that's critical to us to partner with those that do this every day rather than us trying to build our own technology from scratch and making all the mistakes that newbies might make. We seek experienced organizations that have existing infrastructure and leverage their tools and capabilities in order to deliver the highest value services. So those organizations, in order to work with My Health, have to have their own certification with high trust, so they adhere to that same standard. We also have committees that meet regularly, in particular on this topic. The Privacy and Security Subcommittee meets on a monthly basis, and that's an opportunity for us to share information with our participants and for them to talk to us about what their concerns are and to coordinate activities so that the actions that we're taking are consistent with the needs and wants and fears and desires of the data sources. So the data that we have also within the health information exchange can benefit the participant organizations when they have their own issues. Sometimes we've had events in the past where an organization had a problem and had to take their own system offline, which effectively meant all the information in that system became unavailable to their staff. And in those cases, My Health still has that information. So serving in some ways as somewhat of a backup. I don't want to pretend like we're a full-fledged backup because there certainly are differences between the data we've received through the interfaces and what exists within the underlying systems of the original EMRs. But the core clinical data is there, the records are there, and we've been able to see several of our customers be able to essentially continue operating by having their users log into My Health and continue to be able to see the patient records and the critical health information even while their own EMR is offline. And then, of course, they keep their records in some other way until their EMR comes back online so they can put those records into the proper place. but they're not suffering from a lack of historical information when they're helping their customers. So we want to make sure that's something that all of our participants are mindful of when you're developing your own incident response plans and your own disaster recovery, that in the event your system goes offline, My Health can be a tool for your team. And that goes, I mean, just on its surface, we're a tool that can be used to access the data through the user interface, but we do also have the raw data in the original form that we received it in. So that is something that can also be a resource in certain cases where organizations might find value in that. So the other things we try to facilitate at My Health is an open, transparent dialogue. We try to stay on top of all the happenings in the industry. It's critical for us to be aware of what's changing in the regulatory landscape, what's happening on the national scene, the local scene, technology scene, and the policy evolutions of local policies as well. And we talk about things in our privacy and security subcommittee meetings. We try to help all of those who participate in these meetings to not only be there to help make decisions and to help guide the HIE, but to also come away from those meetings with a better understanding of issues that they may be dealing with, that they may need to respond to, and they can get our perspective on it and also share perspectives with their peers in that venue. So that's a monthly resource, that privacy and security subcommittee. I consider that to be a resource that My Health offers to the community. We've got between 20 and 40 regular participants in that meeting, but it could easily be many, many more than that. Our committees are designed to accommodate as many participants as want to participate in them. So I encourage you, if you haven't heard of that before, or if you're not taking advantage of that as a participant in My Health, to talk to your client services rep about getting a representative involved in that monthly collaboration we have on this topic. So I won't talk a lot about these, but the last bullet on here, we have a lot of partnerships across the country. We work with HIEs in the majority of states across the country. We have a collaborative network we work with, and we're also working with CMS on how to responsibly exchange health information on a national level. So those are all connections that we have an inside track on beyond what you might read in public journals and in news feeds. So to kind of sum up here, the most critical thing that I think I'm going to communicate to you all today is maintaining that culture of security and privacy in your organizations. That responsibility that each individual has needs to be something that everyone recognizes and acts on. And it's the most critical component that My Health tries to continue to establish and maintain within our own organization. Everyone operates with this mentality of looking for holes in the armor, looking for problems, and just kind of expecting that something's going to go wrong. So we're ready the second we see it to respond to it. And then exercising those best practices to avoid simple mistakes, make sure that we're using the tools of the trade, using strong authentication, and working together to keep the core information protected of our patients. This is a resource page. I won't spend a lot of time talking through these, but these are things that you might be interested in reviewing when you get a copy of the slides if you're looking for additional resources on these things. And I will pause there, see if we have any questions.
If you have any questions for Joe at this point, go ahead and put them in the chat. And Joe, real quick, so for small practices with limited IT support, what affordable, impactful steps can be taken in your opinion?
Well, the most critical thing is to start with a risk analysis. In fact, let me back up just a little bit on the slides here. These resources up here at the top are actually designed for use in small practices. So I'd recommend one of your first steps be to come here and actually check out this HHS 405D program. That program gives you a step-by-step guide on what you can do. And even though you in a small practice may not understand all the technical terms in there, what you should be able to do is look at that and make a list of the systems that you rely on that are part of your business and assess what could possibly go wrong from the best of your understanding and kind of do your own high level risk assessment. And in any opportunity that you have to talk to people that support those systems, you should do that and ask them to give you assistance because you have this requirement under HIPAA to do your own risk assessment. You can reach out to the organization that sold you that thing and say, hey, for my security risk assessment, I need to be able to identify the risks and the mitigations that you're putting into place for me. And every one of those organizations that are providing those services and systems to you should be able to respond to that and give you those things. Just asking that question of each of those organizations that are supplying you with things is a critical first step because that, number one, makes them aware that you're thinking about it, which makes them aware of it and makes them give you assistance in ways that you otherwise wouldn't be able to. And so just doing that quick run through on all of your systems and requesting security information from people, I think is a valuable first step. A second thing I'd recommend is if you have the capacity to have someone come help you with it, you should. Having somebody come in from the outside and help you understand what's going on and what could go wrong in your systems is going to be much more effective than anything that you can do yourself. And in fact, OFMQ, just to give them a plug, they're a sponsor or a partner, I should say, but they're part of the efforts to improve health information exchange in the state. They are also an organization designed to help providers with these functions. So I would also give them a little bit of a plug there and suggest that you could look at them as a potential partner in this and get a quote for them to help you with that. And there are also, other organizations that market this as a service that you could get quotes from several. And I think it's a good idea for you to investigate engaging someone to help you with it. But that kind of depends on where your budget is and what you think about. So those are my two primary recommendations. One, do it yourself if you don't feel like you can bring in someone else, and second, get a partner.
Awesome. Thank you so much, Joe. With that, we're about at time. There's no additional questions in the chat, but if you do have a question, as a reminder, this presentation will be sent out shortly following this presentation, so you'll not only be able to look at the PDF version of this deck for more information, but you'll be able to go into all of these links individually, click a resource and learn more, as well as utilize the contact page at the end of the presentation to reach out with any additional questions you might have. So thank you again for your time and participation today. Please don't hesitate to reach out for any additional questions, and enjoy the rest of your Wednesday. Thanks for being here, Joe.